Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. Today, my guest is Dr. Tom Farley, a leader in public health practice for several decades, most notably as a health commissioner for New York City and the Philadelphia Health Departments. On this channel, Tom and I have been discussing the massive changes to programs, staffing, and budgets in public health that are occurring at the federal and state level, with a particular focus on CDC. Thanks, Tom, for joining me today.
Good to be here.
I was going to first start out by just giving a little bit of a high-level overview of the types of changes that are occurring, and then I'm going to throw it back to you, Tom, to tell me about some of the specific programs and services that you think are kind of that have gotten cut and that are probably most problematic. So first of all, it appears, and obviously this has all been laid out in the Project 2025 blueprint. So, the current administration is kind of pretty much doing what they had said they're going to do. First round of cuts was to cut off essentially probationary employees. That's anybody who was about to be hired, anybody who was recently hired, and to basically cut off any vacancies and job announcements that were currently pending. So that happened almost instantaneously and immediately, caused problems at a lot of public health agencies within the U.S. government. The second thing they did was then do this reduction in force, or RIF, what a lot of people in public health are calling the April Fool's Day massacre, where I think about 2,400 jobs at least were cut from CDC and then cut from across of HHS. And these were units that were eliminated with, clearly some type of ideological political agenda, as we'll get into. And the next step that I think is almost certainly likely to occur is some combination of clawing back funds. So first of all, we've seen now that they've clawed back funds that were allocated to state and local health departments. These were originally COVID-19 funds, but they were written broadly enough to essentially build public health infrastructure, essentially saying that, look, COVID-19 happened. COVID is still a problem, but really what we need to do is also prepare for the next pandemic. So that money's been clawed back, and almost certainly they're likely to either impound or claw back money that's already been allocated to CDC as part of the budget agreement that the Democrats in the Senate agreed to, was essentially allowing this administration to readjust money between pockets that hadn't been authority that they'd had before. And then, of course, finally, we can also be worried because that Congress is currently negotiating a budget for the next fiscal year, and that is almost certainly to result in even further cuts. So that's kind of the big picture landscape of what's going on in terms of, funding at the federal level. But I want to hone in, Tom, to talk specifically about the cuts that you're most concerned about right now. So what have you seen that has already happened at CDC that worries you the most?
These cuts that happened on April 1st eliminated a number of units, and those eliminations really were not about cost cutting. They were about ideology and politics and payback to campaign contributors. But just to take a few that I'm really upset about. The Office on Smoking on Health. Smoking rates are much lower than they were 20, 30 years ago, but this is still the #1 underlying killer in America, responsible for more than 300,000 deaths each year. The Office on Smoking and Health, what it did was it tracked rates of smoking in the country, as well as rates of other forms of nicotine use, like vaping and these new snooze packs that people suck on. And it also ran the Tips from Former Smokers campaign, which is a media campaign that you've probably seen on TV that has prompted hundreds of thousands of people to quit. And they also provided funding to state and local health departments to do local education on smoking. So this was a key approach and really a low funding approach, given the magnitude of the problem, for our biggest health problem in the country. That unit has been entirely eliminated. Another example I'm very upset about, the Childhood Lead Poisoning Prevention Program. Lead poisoning is a neurotoxin. Shouldn't be in our environment at all, but it is. That program was eliminated. The Milwaukee school system requested help from CDC recently to deal with lead exposure to kids in school there. CDC could not respond because the program was gone, didn't exist anymore. Then there's the National Institute for Occupational Safety and Health, NIOSH. This is the group that does research on how to keep workers safe on the job. For example, coal miners, how to protect their lungs, research on those N95 masks that we all wore during the COVID pandemic and how to have them be as effective as possible. Research on how to safely lift boxes if you work in an Amazon fulfillment warehouse. Low back pain being a big public health problem. An awful lot of people here probably have had low back pain. That was essential research, and NIOSH has been essentially gutted. It almost doesn't exist anymore as a unit. And here's another example that there was elimination of the Division of Reproductive Health. I think probably they thought it had something to do with abortion, but what it really had to do was helping women have healthy pregnancies. And included in that was an ongoing survey. It's called the Pregnancy Risk Assessment Monitoring System, or PRAMS. This is a survey where they collect data on women during pregnancy and after they've had their children that helps really understand the health problems that have occurred there and give data to researchers to understand how we prevent those problems. So all the questions that women have during pregnancy about how can I have the healthiest pregnancy, how can I have the healthiest child, we're not going to have data anymore for them to answer that. And this is happening in a time when preeclampsia rates are rising and we don't know why. So it makes no sense whatsoever to eliminate that. So those are just 4 examples of units that did crucial work protecting the health of Americans that are now gone, but there's many, many more on top of that.
Yes, Tom, I want to drill into a couple of these just for a moment, and at least to highlight my sort of thoughts as well. So today I was just reading that, you talked first about the cuts to the Office of Smoking and Health. I just saw today that they also cut a number of FDA staff that were actually working on retail, monitoring essentially retailers that sell tobacco products and making sure they comply with existing laws and regulations. So what's always so baffling about this is that we say that these are due to ideology, but if you would listen to RFK, and if you took him sincerely, which I wonder about, but if you took him sincerely, you would think that getting, cigarettes out of people's lungs is something that this is an administration that would be all in on. And yet not only have they cut the program at CDC that works on monitoring and education, they've cut the program at FDA that works on enforcement.
Yeah, and they fired the person who was over the Center for Tobacco Products at the FDA, great public health professional. And so these cuts, I think, were mainly done actually by Doge, not by Kennedy. And there was political payback. The tobacco industry donated millions of dollars to the Trump campaign and the presidency. And they don't like regulation. They want to be able to push their tobacco products.
Yeah. And then then the lead poisoning one is probably the most shocking, heartbreaking, and also contradictory one. Again, if you listen to the MAHA, Make America Healthy People Again, they talk all the time about how we've got an epidemic of chronic diseases and bad health in children, and they attribute it to miasma, to chemicals, to electromagnetism, to all sorts of things that are out there. Well, if there's one chemical that you want to get out of kids, it is lead. We have known this for decades, right? That lead is an incredible contributor to basically dumbing people down and makes you dumber, and also probably causes a number of behavioral problems as well. And it's something that I think pretty much everybody across the aisle can agree with, that we don't want our kids to have lead in them. And yet here we are, when a major city in the country calls for federal expertise, federal government is like, hey, sorry, we don't work on this anymore.
Yeah, and when Kennedy was asked about this, he said, well, we knew that when we did these cuts that we would make a bunch of mistakes and we'll probably have to reinstate 20% of the cuts. But you know what? He hasn't reinstated any of the cuts since then. That was just his excuse, and we don't have a lead program.
Yeah. And then, you mentioned before about NIOSH, and, and the thing is that N in N95 is NIOSH, right? Like literally the people that determined what masks make us safer and which ones don't necessarily do anything. That is NIOSH. That actually set the standard for what countries around the world do. And it's obviously not just the masks and respirators that keep healthcare workers safe. Those are the masks and respirators that keep people working in any type of industrial setting in which you're using chemicals or other type of particulate matter is floating in the air. And it's coal miners, right? Coal miners always seem to get touted out or brought out by Republican administrations. It's part of the push against, cleaner renewable fuels. But who actually has coal miners' safety at heart? Actually, interestingly, government organizations that were set up literally to protect their health, to stop coal miners' black lung. They've now all gone. So who's protecting their health? Well, it's going to be industry. And we already know what industry does. If you ask any coal miner whether the industry has their back, it doesn't. It's going to give them back-breaking pain. It's going to give them black lung.
Yeah, it's really horrible. And again, these are just an example of the cuts. There's many more on top of this. And there's been no official list of the cuts. This is something just that people at CDC have pieced together from talking to folks when they learned that they were laid off.
Yeah, I mean, you and I are on these, secret chat groups that are, people from CDC are essentially crowdsourcing. Hey, are you not in the office because you were fired, or are you not in the office just because whatever, you have the day off? And this gets to the issue that one of the many issues that really concerns me is that there is no leadership coming out of CDC right now. There's this kind of weird vortex where Susan Maneras, who is a infectious disease researcher, not somebody who's actually worked in sort of applied public health practice like you and I have, has been nominated to be the official director. She was the interim director and is now nominated to be confirmed by the Senate. Because of this sort of legal loophole that you can't be both interim director and nominated director, there effectively is no leadership coming out of CDC. And we know that from two places. We know that from sources inside CDC who says, look, it's not really clear who's in charge right now. That's number one. But more importantly, we have a measles outbreak right now. This is a country we have theoretically, or at least by certification, declared measles eliminated. We are really at the cusp of losing that elimination status. We have over 500 laboratory confirmed cases across over 20 different states. There is no doubt in my mind, based on the fact that 2 children have died, that the actual number of cases is probably almost double that amount. And when have we heard from anybody in this administration other than one of the most famous, if not the most favored vaccine denialist, which is RFK? If in a normal situation, we would be seeing press conferences at least weekly by the CDC director, backed up by all of the subject matter experts within the National Center for Immunizations and Respiratory Diseases. And there would be provider calls, public messaging campaigns, media stories about CDC disease detectives going into the field. And I don't see any of those. The last thing I saw was, a video of a doctor in Texas who RFK has praised, who actually has measles himself, who's treating patients while he's infectious.
Yeah, the lack of leadership is really quite upsetting.
Yeah, it's really just hard to imagine. And I think what's particularly concerning to us on top of all of this is it's not necessarily going to get better, right? The reorganization plan that has been discussed, it hasn't officially been announced yet in any sort of detail, is to essentially split the agency. And I know, Tom, you've done some writing and analysis of this. So why don't you teach us more a little bit about what the plan is and why this is not going to have the intended effect of making America healthier again?
Yeah, so that no one really knows what the plan is, and who knows what kind of chaotic process they're going through. But there are rumors that people are hearing at CDC, which they say are near certain, that all of the non-infectious disease centers at CDC will be transferred to this new entity called the Administration for Healthy America, which is Kennedy's creation. So that would mean the center that does chronic disease prevention and health promotion, injury prevention, environmental health, concern with environmental toxins, birth defects prevention, and HIV and sexually transmitted diseases, which are actually infectious diseases, that would go as well. So now this Administration for Healthy America is basically built on the Health Resources and Services Administration, or HRSA, and the Substance Abuse and Mental Health Services Administration. These are units that provide services for people who are sick. They're service providers. They're not prevention agencies, okay? They don't think about prevention. They don't have scientists. They don't have epidemiologists, not the ones that issue recommendations the CDC does. So to fold the CDC centers into those service delivering agencies is effectively going to remove their mission. I'm not quite sure what the CDC people will do. CDC is not about providing services. It's about prevention. So I'm actually more worried about this reorganization plan than I am about the cut so far. If the cut so far could, in theory, be reinstated by a new administration as soon as the politics change. But if CDC is basically cut in half and then just withered to die, I'm not quite sure what can happen, whether we will have a prevention agency in the future.
Yeah, it's, I spent most of my CDC career working overseas and helping countries in Southeast Asia and East Asia and in Africa, and also working globally with WHO on trying to strengthen and improve public health. And one of the most common problems that we saw overseas was this, split where public health agencies were often, combined together with other entities that didn't really match exactly what their mission was. So as opposed to having all of the public health experts all grouped together, they were split off and merged with different service entities. Exactly. Kind of what we're seeing the U.S. now backsliding on, right? Around the world, people used to be amazed at how the U.S. government had built together an entire center focused on community and population health, CDC. and had separated off health services and other things in another area. Now, that also creates its problems, of course, right? Sometimes there's too much of an unnatural split between health services and public health. But the creation or concentration of everything into the CDC became the reason why Canada set up the equivalent of a CDC. It's the reason why the UK, well, it's now called the UK Health Security Agency, but it's gone through several agencies. There's a European CDC. I was assigned to China specifically so that they could create a China CDC. They essentially, when I was there in 2008, they had taken the 2006 US CDC org chart and just plopped it onto them and created it. So it's just really, really striking how the US is essentially backsliding on all of this innovation that we led the world in. And we're seeing it now specifically with this attempt to basically cleave off, parts of health and public health into a DC politically controlled unit, and away from where that subject matter expertise used to reside, which is along with the other public health experts.
People often think about what health is healthcare, but actually public health is not healthcare. Most of what determines our health happens outside of the healthcare system entirely. It's whether we smoke, it's the food that's available in our grocery stores, it's the toxins we're exposed to, it's how walkable our neighborhoods. Those are the issues that CDC deals with. Those are not issues that the healthcare system deals with. If we lose that ability, then we lose our prevention ability. And Kennedy's right in that U.S. health statistics are among the worst among developed countries in the world. Despite our putting our money in healthcare, the wrong solution to that problem is to kill off our public health system.
Yeah, without question. I think you and I and everybody else who's worked in public health thinks that, the U.S. government, there is no healthcare system, right? It doesn't really promote health. It's not a particularly caring, and it is absolutely not an organized system, right? It is a hodgepodge of services throughout. And the way to improve that is not to actually defund public health. It's actually to shift a lot of resources that currently go into futile care, excess testing, to administrative costs, for propping up this hodgepodge system we have, and essentially funnel those into prevention. But that doesn't appear to be what they're actually trying to do.
Yeah, so particularly around this reorganization is something for viewers to pay attention to and call the congressman about, because it hasn't happened yet. And I know that there are some people in Congress who are very worried about what Kennedy will do to CDC and to public health. This is one opportunity for them to stop something bad before it happens.
Yeah. And I think that's the most important message we can have for all the viewers out there this week, which is, as always, there is a way to have your voice heard about public health, and that is to use it. Use it on the phone, calling your national representatives, whether it's your House members, whether it's your senators. Use it to call your local officials. Your local officials have a voice too, right? They can get more resources allocated at the city or state level, but they can also use that to trade that up the chain. Call into radio shows, post on your social media feeds, use your voice wherever you possibly can to fight for public health. And I think that's one of the most important messages, we can get out there for all of you today. And for my purposes, of course, if you liked what you are seeing and you want to make sure other people hear this as well, please like this episode, share it, and subscribe to Thermometer, because we're going to keep you updated on the most important news going on public health and infectious diseases here in the United States and around the world. So thank you all for watching today. And thanks, Tom, for joining me.
Thank you.